Hello friends, in this video we are going to discuss about the radiographic anatomical landmark of maxilla. First we are going to see the anatomical landmark of maxillary incisor. It include mid-palatine suture, nasal septum, nasal aperture, nasal fossa, incisive foramen, anterior nasal spine. Intermaxillary suture or mid-palatine suture. It appears as the curved radiolucency in the midline of maxilla. Anterior nasal spine. It appears as a radio-opaque, irregular or V-shaped projection from the floor of the nasal aperture in this midline. Anterior floor of the nasal aperture. It appears as a radio-opaque line extending lateral from the anterior nasal spine. Nasal septum. It is seen directly above the anterior nasal spine and covered on each side by mucosa. Incisive foramen. It appears as a ovate radiolucency between the roots of the central incisor. Nasal fossa. It appears as a radiolucent space on each side of the nasal septum. Soft tissue outline of the nose. It is the superimposed over the anterior maxilla. Canine. Inverted Y of Ennis. In the periapical region of the maxillary canine, in radiographically, the lateral wall of the nasal fossa and the anterior border of the maxillary sinus form an inverted Y, which is termed as inverted Y of Ennis. Lateral fossa or incisive fossa. It is a translucent on the periapical projection. Nose. Soft tissue of the tip of the nose is seen in the projection of the maxillary central and the lateral incisor. The image has uniform, slightly opaque appearance with a sharp border. Floor of the maxillary sinus. A thin layer of the cortical bone and appear as a thin radio-opaque line. Extend from distal aspect of the canine to the posterior wall of the maxilla above the tuberosity. Premolar. The floor of the maxillary sinus. It is radio-opaque line near the apex of the maxillary premolars. Maxillary sinus. It is a vast air space and appear as the radiolucent space above the maxillary teeth. Sinus septa. It appears as a thin radio-opaque line compartmentalizing the maxillary sinus. Molar. The floor of the maxillary sinus. Radiographically, these cavities are visible as thin radio-opaque line passing above the apex of the molar teeth. Maxillary tuberosity. On radiographic, it appears as a radio-opaque bulge located distal to the third molar. Zygomatic process. It is seen radiographically as a J-shaped radiopacity with its open end directed superiorly. Pterygoid process. The pterygoid process is observed as a homogeneous radio-opaque shadow without any trabecular pattern. Hamelar process. This hook-like extension of the pterygoid pit appears radiographically as a radio-opaque hook. Coronoid process. Coronoid process is a triangular projection seen in the maxillary third molar. It's become evident when the mouth is opened wide, moving the coronoid process down and forward.
Now, we are going to learn about the radiographic anatomical landmarks of mandible. Let's see the radiographic anatomical landmarks of the mandibular incisors. Genial tubercles. It is located in the lingual surface of mandible along the midline just above the inferior border of mandible. It is spine-shaped and has bony protuberances. It is divided into left and right in the horizontal aspect and has superior and inferior in the vertical aspect. Lingual foramen. It is located in the region of the genial tubercles. Its contents are superior foramen, which contains lingual arteries and nerves. Inferior foramen, which contains sublingual arteries and mylohyoid nerve. Mental ridge. It is found as an extension from the lower premolar area on each side to the midline. They lie just inferior to or are superimposed on the mandibular incisor tooth roots. They are radio-opaque lines shaped as lines that are sweeping bilaterally forward and upward toward the midline. Mental fossa. It is a depression on the labial aspect of the mandible, extending laterally from the midline and above the mental ridge. Now, let's see the radiographic anatomical landmarks of mandibular canine. Mental ridge. It is a radio-opaque ridge on the radiograph. It is a prominence of bone on the labial surface of the anterior mandible. Next, let's learn about the anatomical landmarks of mandibular premolar. Mental foramen. It is an opening in the bone located on the external surface of the mandible, in the region of the premolars. On the radiograph, a small ovoid or round radiolucent area in the apical region of the premolars. Mylohyoid ridge. It is located on the lingual surface of the mandible, extending from third molar area to premolar region. Serves as an attachment for the mylohyoid muscle. On the radiograph, it appears to be a dense radio-opaque band extending downwards and forward from the molar region. It may appear continuous with internal oblique ridge. Submandibular fossa. It's a scooped out depressed area of the bone located on the internal surface of the mandible inferior to the mylohyoid line. It houses the submandibular salivary gland. On the radiograph, it appears as a radiolucent area in the molar region below the mylohyoid ridge. Mandibular canal. A dark linear shadow with thin radio-opaque superior and inferior borders cast by the lamella of bone that bounds the canal. It is apparent between the mandibular and the mental foramina. It comes in close contact with all molars and the second premolars. As our last topic, let us learn about the radiographic anatomical landmarks of mandibular molar. External oblique ridge. It is a linear prominence of the bone that is located on the internal surface of the body of the mandible. It ends in the region of the third molar. Internal oblique ridge. Linear prominence of bone that is located on the internal surface of the mandible. It extends downwards and forwards from the ramus of the mandible. It may end in the region of third molar, or it may continue as the mylohyoid ridge. Mandibular canal. It is a tube-like passage through the bone that travels the length of the mandible. It extends from the mandibular foramen to mental foramen. Submandibular fossa. It's a scooped out depressed area of the bone located on the internal surface of the mandible, inferior to the mylohyoid line. It houses the submandibular salivary gland. Lower border of mandible. As the name suggests, it is the lower border of the mandible. It's rarely seen on the periapical projections. Now, as we have reached the end of this video, we hope that we have made clear about the radiographic anatomical landmarks of maxilla and mandible. Thank you.